Hello and welcome to our Pharma Talk at McKesson ideaShare on community health workers. I'm really thrilled to be here today to talk to all of you about this. As a pharmacist, I'm a pharmacist with HealthMart. My name is Suzanne Feeney, and my role is to really help to coach pharmacies within the Midwestern states. And one of the things we talk quite a bit about is community health workers. So we have two experts here with you today. We have a pharmacy owner who is going to describe the path forward in both of her pharmacies, and then we have a pharmacy technician who's actually gone through the course. So before I get to their introductions and let you hear from them, I did just want to set a little bit of the stage about why this is so important for our communities and for our pharmacies. So I'm sure you've heard a lot about social determinants of health over the past few years. And if you look up the statistics from HHS, what you'll find is if you're impacting a patient's life and their clinical impact, gonna compete with bingo. We got this though, we got this. So if you're looking at clinical impact, 50% of that impact is from social determinants of health, where 20% is from medical care. So to put that in perspective, transportation, access to food, access to childcare, that impacts all of our health by 50%. Whereas the medications we take, the screenings we have, our physician and prescriber appointments is 20%. So that's how truly important this work is. And that's where we're able to implement community health workers to really take ownership of that in the pharmacy. Because I know, I've been a pharmacist, in the bench, I know you guys are doing that every day. You have patients who can't get their medication because of transportation issues, because of cost access issues. And we try to plug into that the best we can, but to have somebody trained in the pharmacy that can do that and then even be paid for that is a really huge lift. It's a huge burden lifted for both the patient, for the community, and then also to really facilitate this within the pharmacy. So that's what we're here today to talk about. That's what this is all about. So enough about me and the background. I would love to introduce you to our two amazing speakers today so you can learn a little bit more from them. So first we have Sindhuja Maragu. I totally messed it up. I'm so sorry. Maragu, Sindhuja Maragu. And Sindhuja is a certified pharmacy technician who has actually gone through the community health worker course. So she's gonna talk a little bit about that from her perspective. She works at Family First Pharmacy in Texas. So we'll get to hear from her. We also have Katie Bass. Katie is a native to California, and she graduated from the University of Hawaii Pharmacy School, so I definitely need to hear more about that. After graduation, she moved back to California and worked at her father's pharmacy as the pharmacist in charge, recently purchasing the pharmacy in 2019, and then recently opening another pharmacy. So with that, let's hear a little bit from our two guests. And Katie, maybe I'll start with you, and just talk to us a little bit about how did you learn about community health workers, and what was your motivation to dig into this?
Can you hear me? It's not on. Yes. Hello? Okay. So I originally heard about the community health worker when I got an email from CE Impact offering a free training course for certified pharmacy technicians to become a CHW. And honestly, I've always just been an opportunist. Anytime anything was thrown at me, I was like, yeah, let's do it. Let's try it out. It's a free training course. Why not? So that's kind of how we initially got introduced to it. And then as my techs went through the program and learned about it, they kind of helped bring that back to me and teach me about what a community health worker was. And they really helped me get my program going and off to start.
I love it. So you just jumped in. You're like, I'm not sure what this is going to do, but it's going to be good, and we're going to jump in.
Yeah, free training opportunities. Can't pass those up. So
I love it. I love it. And we'll talk a little bit about your journey and where that's taking you. So I love that you've been a pioneer of this. But Sindhuja, talk to us about why you decided to do the course.
Sure. Perfect. It's working. So I was personally motivated to do this course because I think society and we as healthcare providers have a responsibility to make sure our patients are taken care of, not just with pharmaceutical medications, but also with everything else that's provided to them in the community. And it's just been a passion of mine because we help patients and we do all of these things on a daily basis anyway, so why not learn more about it, become certified, and make more of an impact in the community.
I love that. I love that. So since you've gone through the course, From what I've heard, it is truly like a college type level course for pharmacy technicians. So tell us a little bit about how you made time for that and what that looks like within your day job.
Sure, yeah. So it is a 16-week commitment for pharmacy technicians. The way that we figured it out within my pharmacy role and my day-to-day was I'd work in the pharmacy for about 6 hours, and the course would be every Tuesday evening for 2 hours from 6 to 8 p.m. on Tuesday evenings, Central Standard Time. And then there was also opportunities for me to go out into the community and find resources, make connections with all of the different organizations in the community, like, nonprofit organizations, shelters, food pantries, and other free health clinics that are available to other people in the community as well. So it was, it's a commitment, but I think it's definitely helpful to be that liaison so that when people come in and they're struggling to find healthy foods and find shelter or find a way to navigate the crazy healthcare system, you're able to say, hey, actually, I know this person, I've talked to them, here's their phone number, here's their email address. I'll call them and let them know you're on the way so they know who's coming into their door and can have a list of things ready to go to help you out.
That's amazing. And all of you as Health Mart pharmacies have access to a resource called findhelp.org. I was thinking about that. One of the nice things about the training is you get plugged into those local resources, and the technicians get that, kind of paper binder, if you will, and create those established relationships. But all of you right now without that can use and leverage findhelp.org, where you can put that on your website and you can direct your patients to it, or you can help them with that in the pharmacy. And they have the ability to put in their zip code, and then whatever the challenge is that they're facing, whether it's transportation, childcare, different types of services, we'll plug them into local community resources. So I see you both nodding your head. Katie, maybe you can talk more about that because it sounds like you're using it at your pharmacy.
Yeah, we do use it some. My girls kind of like the binder idea, so we definitely have that, especially for the local resources. I think part of the reason we did that is we didn't realize that that website was out there, but it's so easy. You just literally put in the zip code of your pharmacy or where your patient's at, and it says transportation, food, childcare, and you just click that, and the links of the resources are right there. So, and because it's a website, it's ever changing and updating, which is nice. You get those hard copy binders, and sometimes that information becomes outdated, but it's such an easy to use navigatable site. Yeah,
that's amazing. So maybe you could tell us a little bit, Katie, about what the day-to-day looks like for the community health workers at your pharmacy. And spoiler alert, Katie's in the state of California, and her pharmacy is able to be paid for these services, which is really exciting. And we're going to dig into that a bit. But maybe tell us, how does the role change when a pharmacy technician is now a certified health worker? What does that look like?
So I will say the pharmacy technicians I chose to train were already kind of behind the scenes for me working on clinical stuff. So it just seemed like a really natural fit to have them get this training as well. So that's kind of who I chose to get in this role. I thought they'd be good fits anyways. And plus they already had time carved out from being on the floor and filling for me. So that's kind of, it just made sense. And now they could get paid for this stuff that I was basically having them do anyways. So that's who I chose to do the training. And like you said, so I just carve it out of my time period. We do it afternoons after our deliveries go out for a few hours. And they'll do the behind the work paper billing and stuff. But I also really like to intervene at the point of sale. It's just had the most success for us. When a patient walks in, maybe a newly diagnosed diabetic, a person who's constantly refilling their inhalers, but not their maintenance inhaler, things like that, where it's easy interventions. And a lot of it might be lifestyle changes that I know about. I just don't have the time to sit there and explain to them. I can say, hey, CHW, go talk to this person. And in our state, we do get to bill for those services. We get paid 150% rate Medi-Cal. So for a 30-minute unit service, we get paid, I don't know if I'm allowed to say the dollar amount, but $45 for 30 minutes of service. And you can bill up to 4 units of service, which is 2 hours. So if you sit down with the patient for 2 hours, it's $180. You're paying your community health worker $23 an hour, And it's really just sitting there and talking. It's stuff we've all done already anyways. It's just now we could maybe get paid for it.
And your your pharmacy technicians have gone through the training, they're plugged into the resources, and that's really the conduit for that payment, is that they understand how to plug into that and help, again, with those clinical outcomes. So 50% impact. So this is lowering healthcare costs for the state, which is why there's that important connection.
Yes, hugely, exactly. If we can teach a patient to properly use, especially where I'm at in the Central Valley, we have horrible air quality. So it's constantly an issue. And a lot of patients, aren't really trained about even the difference between the inhalers. They just know when they use their albuterol, they get relief. They use the other one, it doesn't really change anything, because they don't understand the whole mechanism of how it works. So to be able to sit down and really explain it to them is huge. And even what, triggers are, they should stay indoors on these days, all those things like that. It's gonna lower our emergency room visits, which, I don't know about your area, but our hospitals are constantly impacted and they can't take on those patients. And we all know the cost of an ER visit versus going to a pharmacy and having a half-hour lecture about how to use your medications properly. So it's a huge advantage for the patient, huge advantage for the pharmacy, the community. There's just a win-win across the board.
Yeah. So who out here is not in California? Probably most of us, right? Okay. So we want to extrapolate a little bit about what these two have encountered. So Katie's in California and is able to plug in and be paid for this. But I don't think you knew that when you started. You said, I got this information on training, I'm going to jump in. Is that fair?
Yeah. I had no idea if I would be paid. And luckily our Medi-Cal is pretty progressive. So they said they would pay you, but you actually have to be paid by the county health provider, because each one of them have their own MCOs. So yeah, the state will say, we'll pay for these services, but if you're not plugged into that county as a health provider, you're not going to get paid. So one of our pharmacies has had great luck, and we've had a super open plan. The other pharmacy, not so much. Their plan has been very unhelpful, to say it nicely.
So how did you start down that path, right? For these people out here who aren't in California and maybe not know the opportunity to plug in, what was the first step that you took to see, hey, how can I, you see value in doing this in your pharmacy regardless of the payment model or not, but what's that first step that people can take?
So the first thing we did was we knew which plans served our MCOs, so we looked up on there, and one of their plans actually had it on their website. They had a grant funding available for bringing in a CHW, $65,000. They'd pay for a year of training, $10,000 if they were bilingual. There's a ton of money out there. So I definitely recommend looking into your public health department if you have a relationship with them, your MCOs, like I said, your local health plans. If they have any funding towards that, or you have a good relationship, I highly recommend leveraging those relationships. There's funding out there. Like you were talking about earlier, it's a big goal of the CDC. So there's a lot of money out there. Grants are another opportunity. Again, looking at public health department, the CDC, and your local MCOs, I think is a great place to start.
Yeah. I love this for community pharmacies. You're the hub of your communities, so you're really able to impact the patient's healthcare, connect them to resources, and have training for your pharmacy teams. So, Sindhuja, what tips would you have for anybody who's considering offering this to their pharmacy technicians to help lighten the load or make this a little bit easier?
Sure. I think first and foremost, your pharmacy technician that you end up choosing or offering this opportunity to needs to be a pharmacy technician that has the empowerment within them and can really fill in the gaps with cultural competency and health literacy and just being that trusted source for all of your patients. I think that's the most important. And then tips and tricks, I think, it's once you're in it, I found myself just on healthmart.findhelp.org, just looking up everything I could possibly think of, because you feel passionate to help all of these patients who are struggling, and it's, I think it just comes down to the person. And I know community pharmacy is definitely, like you were saying, a hub, and there's a lot of trust that you have with your patients because you see them once a month, once every 3 months, and that's more than most of them go see a doctor or go see another healthcare provider. So I think that's where it all makes sense and it connects in my mind. So, yeah.
Amazing, amazing. I do want to allow a few minutes for questions, but any last insights to share with the group?
No, I mean, I think if the opportunity's out there, there's tons of grant scholarships. If you have opportunity to free train, like you said, picking the right person is really important, but just do the training now. Even if the funds aren't available in your state, it's coming. I mean, this is the direction that healthcare is going. We keep seeing preventative disease more and more, and this is kind of the next step towards that. So even if you're not ready to start a program, your state isn't quite on board, get the training now, especially when it's offered for free and low cost right now.
Yeah, so I'm hearing some takeaways that might be good for the group, especially if you're not in California, which I know is the majority of us. You can plug in right now to findhelp.org. So there's HealthMart, findhelp.com. You can plug into that and use this as a resource in your pharmacy. You can direct your community and your patients to that. You're able to take that link and put it on your website. So that's an easy way to connect to resources. And then start to engage with your state associations, start to engage with your local boards of health, and look for opportunities for how you can collaborate. And then there is, when you're ready, there is a community health worker course that's available. And I think a good first place to start is talking with your state association about what opportunities are there, what progress they're seeing. So there's some nice ways to get started now. Personally, if you take anything away from this, the Find Help site, I know would have helped me immensely when I was trying to help my patients navigate that so that they could take care of their challenges and be able to continue to receive their medications. And that's sometimes hard to do with a staff level that we're all out. So I think that's a nice turnkey tool. We have maybe a couple of minutes for some questions. So I do see some hands up, and maybe what we'll do is come around with the mic. Cindy has the mic here, so we can hear you.
I just completed the course in January. How do I begin starting this out? Because I know you said something about we do have a lot of people who do not, they're overuse their albuterol inhalers. How do you, in our state, technicians cannot counsel. So how do we handle that?
So in our state, we have the same thing. So I did a CE on this, but it's really important you have policies and procedures in place so your patients understand when they're being consulted on a medication and when they're being consulted by a health worker. Okay. So in our state, there's a special program called asthma, and they train. You can get a certification that basically says you understand the different inhalers, you know how they work. So they take a special training on that. So we make sure at our pharmacy, if that's what she's going to be consulting on, let's say I don't have time to sit there, I have to do the basic medication consultation. That's a part of our state law requirement. So I'll do that. But if the patient has more questions or clearly they aren't figuring out how to use it right and things like that, I'll send them somewhere with my health worker. Hey, my community health worker is going to sit down and talk to you. And so the patient's aware that it's not the pharmacist anymore, and it's also a separate area. So we have policies and procedures to make sure that we're not violating that.
Okay. Now, also, our state, we don't do any billing right now. But in the other class, you said go ahead and get your NPI for this?
Yes.
And then you would be ready for when billing starts?
Yes. And getting your NPI number is super easy. You just literally go online, and they'll shoot you one right back. It's very easy, so do that.
Okay. Well, I thank both of you so much for your time today. We do have another question. Thanks, Ashley.
Technically not a question, but I do have the QR code for Find Help for you all, so if you want to come see me. And I do have additional information that's freely available training for CHWs for continuing education, not for certification, but for resources that are freely available. I've got a lovely little QR code for those of you that are certified or team members that are certified. Thank you for letting me do a shameless plug.
Thank you. Thank you. That's great. Well, thanks everyone for joining us today. Special thanks to our speakers. We do have back-to-back Pharma Talks, so we will shut down questions for now, but I think the two of you will be around off stage for a few moments to chat, and just really appreciate your time and engagement today. Thanks all.
Thank you.
Thank you.